Renal calculi, also known as kidney stones, are solid masses that form in the kidneys. In this video, we will cover the definition, prevalence, impact on kidney function, diagnostic approaches, and management strategies of renal calculi. In summary, renal calculi are solid formations in the urinary tract and can occur in any part of the urinary system. The prevalence of kidney stones is increasing worldwide due to various factors. These stones can have a significant impact on kidney function and can lead to complications if not managed appropriately. Renal calculi, or kidney stones, are formed when certain substances in the urine crystallize. Factors like pH, concentration, and inhibitory or promotive factors affect crystal growth, leading to different types of stones. Hydration, diet, and medication are important in managing and preventing renal calculi. Dietary factors are important in the development and prevention of kidney stones. Certain foods can increase the risk of stone formation, while others can help prevent it. Dietary modifications, such as increased fluid intake and a low-sodium diet, can be effective in managing kidney stones. In the medical management of renal calculi, medications are used for pain relief, stone dissolution, and preventing complications. Pain relief involves using NSAIDs and opioids. Medications like citrate supplements and thiazide diuretics can prevent stone formation. Lifestyle modifications and dietary changes are also important. Renal calculi, or kidney stones, can sometimes be managed medically, but surgical intervention may be necessary for larger stones, significant obstruction or infection, or failed conservative measures. Minimally invasive procedures like ESWL, PCNL, and ureteroscopic stone removal, performed through small incisions or natural body openings, have greatly improved outcomes and reduced the need for open surgery. The choice of surgical approach depends on factors such as stone size, location, composition, and patient health. Radiological imaging is crucial for diagnosing and understanding renal calculi. Modalities like plain abdominal X-ray, ultrasonography, CT scan, or MRI are used to visualize and characterize stones accurately. Interpretation requires knowledge of stone characteristics and associated complications, ensuring proper diagnosis. Urinalysis and stone analysis are essential diagnostic tools in the evaluation of renal calculi. Urine samples can provide valuable information about stone-forming substances, urinary pH, and the presence of urinary tract infections. Urinalysis may reveal the presence of blood, crystals, or urinary casts, which can suggest the presence of renal calculi or associated complications. Stone analysis involves identifying the composition of retrieved stones, which aids in determining the underlying cause and guides further management strategies. Various laboratory tests, including infrared spectroscopy or X-ray diffraction, are employed to accurately assess stone composition. Different stone types require targeted interventions and preventive measures, making stone analysis an integral part of the diagnostic workup. Recurrence of renal calculi is common, emphasizing the importance of implementing preventive measures. Lifestyle modifications, patient education, and pharmacological interventions are key strategies for long-term management. Regular follow-up and monitoring are necessary for optimal management. Renal calculi can cause various complications, including renal colic, hydronephrosis, and infection. Prompt identification and management are essential to prevent long-term damage. Treatment options depend on stone size, location, and symptoms, involving a collaborative approach between healthcare professionals. Metabolic disorders play a significant role in the development of renal calculi. Understanding these underlying conditions is crucial for managing stone recurrence effectively and preventing long-term complications. Hypercalciuria, a condition characterized by increased urinary calcium excretion, is one of the most common metabolic disorders associated with stone formation. Other metabolic abnormalities include hyperoxaluria, hyposiderturia, and hyperuricosuria. Management of metabolic disorders involves a multidisciplinary approach, including dietary modifications, fluid management, and pharmacological interventions. Calcium and oxalate intake restrictions, citrate supplementation, and allopurinol therapy may be employed based on the specific metabolic abnormality. Individualized care is necessary, as the approach varies depending on the underlying metabolic disorder and stone composition. Although renal calculi are more commonly seen in adults, pediatric nephrolithiasis is an increasingly recognized problem. Children with renal calculi present unique challenges and require specialized evaluation and management. The etiology of pediatric nephrolithiasis differs from that in adults, often involving metabolic or anatomical abnormalities. Comprehensive evaluation includes a detailed medical history, physical examination, laboratory tests, and imaging studies. Management approaches in children focus on stone prevention, similar to adults. However, considerations such as growth, development, and the impact of dietary modifications on overall nutrition must be carefully addressed in the pediatric population. Collaboration between pediatric nephrologists, urologists, and dietitians is critical in managing pediatric nephrolithiasis and preventing long-term complications. Pregnant women with kidney stones face unique challenges. Careful consideration of risks and benefits is needed for diagnostic tests and treatments. Pain relief, hydration, and monitoring are key. Surgery is a last resort. A multidisciplinary team is important for optimal care. Renal calculi, also known as kidney stones, are a common condition that can significantly affect kidney health. This video has covered numerous aspects related to renal calculi, including their definition, prevalence, impact on kidney function, diagnostic approaches, management strategies, potential complications, and considerations for specific populations. By understanding the complexity of renal calculi, healthcare professionals can deliver enhanced care and improve patient outcomes. Ongoing research and advancements in medical and surgical interventions are promising for better management and improved quality of life for those affected by renal calculi.